Today's topic is different signs and appearance on skull radiographs. First, congenital and developmental cotton bitten skull, multiple convolutional marking due to raised intracranial pressure. इंट्राक्रेनियल प्रेशर बढ़ जाने से ये साइन दिखाई देता है. लैकुनर स्कल, honeycomb lucensis seen in CRE2 malformations. CRE2 malformation में ये साइन दिखाया जाता है. क्लोवर लिप स्कल, ट्राइलोब्ड स्कल अपीयरेंस इन सीवियर क्रेनियोसिंटोसिस. क्रेनियोसिंटोसिस का साइन होता है क्लोवर लिप स्कल. टावर स्कल, टारिसेफाली, tall vertically elongated skull due to coronal synostosis. Scaphocephaly, boat-shaped elongated skull from sagittal synostosis. Plagiocephaly, asymmetric skull flattening due to unilateral suture fusion. Brachycephaly, short, broad skull caused by bilateral coronal synostosis. Trigonocephaly, triangular forehead from metopic suture synostosis. Microcephaly, abnormally small skull with reduced intracranial capacity. Macrocephaly, enlarged skull vault often associated with हाइड्रोसेफलस. हाइड्रोसेफलस के कंडीशन में कभी कभी स्कल का साइज इंक्रीज हो जाता है, उसको मैक्रोसेफली बोलता है. दूसरा पैरा में होता है रेज्ड इंट्राक्रेनियल प्रेशर में क्या क्या साइन दिखाई देता है. फर्स्ट, डिजिटल मार्किंग, प्रोमिनेंट गायरल इंप्रेशन ऑन द इनर टेबल of skull. Suture diastasis, widening of cranial sutures due to increased ICP or intracranial pressure. Erosion of dorsum sella. Cellar remodeling in chronic intracranial hypertension. Thinning of calvarium, generalized vault thinning from long-standing pressure. Enlarged sella darsica. Expanded pituitary fossa from chronic pressure effect. J-shaped sella, curved cellar contour, often seen in hydrocephalus. Ballooned sella, globar enlarged sella associated with pituitary lesions. Double floor sella, two-layered cellar floor from pituitary adenoma remodeling. Pressure erosion of clinoids, resorption of clinoid processes in cellar masses. Expanded diplopy space, widening of diplopy secondary to chronic intracranial changes. Next, anemia and marrow expansion related signs and appearance. First, hair on end appearance, perpendicular trabeculi in thalassemia or sickle cell disease. जो हेयर ऑन एंड appearance होता है ये बेसिकली थैलासेमिया एंड सिकल सेल एनीमिया में दिखाई देता है. Crew cut skull, short vertical striation from marrow hyperplasia. Widened diploid, expanded marrow space in chronic hemolytic anemia. Thinning outer table, outer cortical thinning due to marrow expansion. Coarse trabeculation, prominent diplopic trabeculi in chronic anemia. Next, signs and appearance due to metabolic bone diseases. Salt and pepper skull, granular mottled demineralization in hyperparathyroidism. जो सॉल्ट एंड पेपर स्कल अपीयरेंस होता है ये हाइपरपैराथाइरोइडिज्म में दिखाई देता है. ग्राउंड ग्लास स्कल, होमोजेनस हेजी बोन डेंसिटी इन फाइब्रस डिस्प्लासिया. फाइब्रस डिस्प्लासिया का केस में होमोजेनस हेजी बोन डेंसिटी दिखाई देता है जिसको ग्राउंड ग्लास स्कल भी बोला जाता है. कॉटन वूल अपीयरेंस, Patchy fluffy sclerosis in Paget's disease. Cotton wool skull Paget disease में दिखाई देता है. Diffuse osteopenic skull, generalized calvarial demineralization in osteoporosis. ऑस्टियोपोरोसिस के केस में डिफ्यूज ऑस्टियोपेनिक स्काल साइन दिखाई देता है. रैचिटिक क्रेनियोटेबिल्स, सॉफ्टनिंग ऑफ स्काल बोन्स इन रिकेट. हाइपर ऑस्टियोसिस फ्रंटालिस इंटरनल, bilateral frontal inner table thickening, common in elderly women. Leontiasis osseosa, massive facial and skull bone overgrowth. Acromegalic skull, enlarged frontal sinus and thickening of calvaria in case of acromegaly. Osteopetrotic skull, diffusely dense. This is also called marble bone appearance. Next, due to lytic lesions, some signs or appearance occurred. First, punch out lesion, well defined lytic defect of multiple myeloma. मल्टीपल माइलोमा में ये साइन दिखाई देता है, पंच आउट लेसन. रेन ड्रॉप स्कल, न्यूमरस स्मॉल लाइटिंग डिफेक्ट इन माइलोमा. जियोग्राफिक लाइटिक डिफेक्ट, लार्ज sharply marginated skull destruction. Beveled edge lesion, asymmetric inner and outer table destruction in eosinophilic granuloma. Barton sequestrum, central bone fragment within a lytic lesion. Next, soft bubble in appearance. This is very important in MCQ preparation for upcoming exam. Soft bubble appearance is seen in expansile multiloculated lytic lesions. Next, sun ray destruction, aggressive radiating bone loss pattern. Moth-eaten skull in irregular multiple lucencies suggesting aggressive pathology. Permeative destruction, teeny ill-defined lucencies indicating malignant infiltration. Lytic frontal lesions, common presentation of eosinophilic granuloma. Signs and appearance seen in sclerotic lesions. First, ivory skull, diffuse homogeneous calvarial sclerosis में दिखाई देता है. N flake meningioma, focal hyper osteotic thickening adjacent to meningioma में आसपास में focal hyper osteotic thickening जैसा दिखाई देता है. Sclerotic metastasis, dense calvarial lesions, classically from prostate carcinoma. Osteoma, dense, well circumscribed exovitic skull lesion. Hyperostotic frontal bone, excessive frontal bone thickening in meningioma. Pagetic sclerosis, thickening dense skull with enlarged bone contours. Fibrous dysplasia sclerosis, expansile bone with mixed ground glass density. Osteoblastic calvarial lesion, new bone formation producing in increased obesity. Patchy calvarial sclerosis, multifocal dense areas in metastatic disease. Dense base, increased basal bone density in osteopetrosis. Signs and appearance related to fracture sign. First, linear skull fracture, thin radiolucent line crossing the calvarium. For depressed skull fracture, inward displacement of skull fragment is seen. Diastatic fracture, fracture extending through and widening a suture. Basilar skull fracture, skull base fracture often with associated sinus hemorrhage. Ring fracture, circular fracture surrounding the foramen magnum. Growing fractures, progressive fracture widening in children due to dural tear. Ping pong fracture, smooth depressed neonatal skull fracture without cortical break. Comminuted fracture, multiple fragmented calvarial pieces seen around the fracture region. Battle sign correlation, masted fracture associated with posterior skull base injury. Air fluid level in sinus, indirect signs of adjacent facial and skull base fracture. Skull base and sinus appearances. First, enlarged frontal sinus seen in prominent frontal pneumatization in acromegaly. Absent frontal sinus seen in case of congenital non-pneumatization variant. Sphenoid sinus opacification, soft tissue density replacing normal air. Maxillary sinus agedness, mucosal thickening or sinusitis. Air fluid level in sinus, acute sinusitis or post-traumatic hemorrhage. Expanded sphenoid sinus. Pneumatization extending into surrounding skull base. Erosion of skull base, destructive process involving the cranial base. Clival destruction, aggressive lesion affecting the clivus. Sometimes in case of pituitary tumor or pituitary mass, clival destruction is seen, which is aggressive lesion affecting the clivus. Petrous apex opacity, inflammatory or neoplastic petrous lesion, mastoid clouding, loss of normal mastoid air cell translucency. Next, signs and appearance related to intracranial calcification patterns. Pineal gland calcification seen as normal midline calcification in adult. Displays pineal calcification midline shift suggesting intracranial mass effect. Choroid plexus calcification, physiologic ventricular calcification. Falx cerebri calcification seen in dense linear midline dural calcification. Basal ganglia calcification seen in symmetric deep gray matter calcification. X cell calcification seen in thin peripheral calcified rim around the lesion. Tooth-like calcification, complex calcification seen in dermoid or teratoma. Curvilinear meningioma calcification, arc-shaped calcification within a meningioma. Calcified craniopharyngioma seen as suprasellar calcified mass, especially in children. Starch-Weber syndrome. In this case, we can see tram track-like calcification, which is parallel gyriform cortical calcification. Next, signs and symptoms related to vascular and special signs. Enlarged medial meningeal groups, prominent vascular channels in high flow states, serpiginous vascular channels, torsous skull vessels suggesting arterioventricular malformation. Carotid canal enlargement seen in expansion by aneurysm or vascular anomaly. Foramen oval enlargement, possible trigeminal schwannoma or vascular lesion. Foramen magnum widening caused by or seen in achondroplasia or skull-less abnormality. Empty sella appearance in case of enlarged sella with reduced visible pituitary tissue. Ballooned skull vault, marked cranial expansion in severe hydrocephalus. Craniolacunia, multiple oval lucencies in the neonatal skull. Thickened calvarium, diffused vault thickening in Paget disease or clotting anemia. Sunburst appearance, which is radiculating or radiating spicules of aggressive osteogenic lesions.